like with any procedure, complications can occur. And I think that bringing these potential complications up at the forefront of a consultation is, extremely important for all patients. Certainly hematoma or a bleeding is a risk with any procedure where cutting is involved. And my particular patient had a hematoma confined to the buccal space itself. And so understanding, first of all, that that is a potential complication, and recognizing the complication is the most important thing for a surgeon to do. I think that retrospectively, the options for this patient, aside from gaining control through an interventional radiology approach, would have been to let the vessel kind of seal itself off, because the buccal space is a confined space, and eventually it would have ceased the bleeding. The issue with that, though, is that you're going to have a patient that has a collection of fluid or hematoma on one side of the face, and you're going to have persistent asymmetry for some time. And so I think the best solution in those cases are basically going to be to drain the hematoma and try to isolate the potential bleeding vessel. And the challenge with buccal fat is obviously through a minimally invasive approach, intra-orally through a tiny incision, you don't know exactly where the bleeding could be coming from, because the incision's extremely tiny, and you're going in through the mouth to find it. And so it's very rare. That is the one, knock on wood, one and only time that I've ever had a hematoma from a buccal fat pad reduction. But it's something that I'm keenly aware of now, and I feel much more comfortable with being able to manage something like that. Other complications that could occur from this could be temporary or permanent facial nerve paralysis, because the buccal branch of the facial nerve does traverse this area. And then also the main duct that empties saliva from your parotid gland, so the big spit gland that lives right here, is in the vicinity of your operative field. And so if you make an incision across that duct, or you throw a stitch through the duct or something of that nature, then you could have a collection of saliva either within the gland, or a sialocele or something that develops adjacent to the duct, which would require some advanced parotid duct repair. And that's, again, a rare complication. This procedure does carry some risk, but it's extremely low risk.